After we do a little bit of a check-in, we're going to move into our Network in Action segment. And that we've called it Village News in the past, or I'm sorry, no, we've just called it Network in Action, where we hear a little bit about some of the other important work that's happening in and around our area or that we're connected to. So we're going to hear from Barb about Healthy Aging Alberta. Rosalie is going to tell us about a project that has just started up, Aging and Community Supports. And then Caroline will give us the news about Age Friendly Edmonton. And then we're going to move into Village News, and that's an opportunity for people to share information or ask questions from the group. And so we'll put this back up when it comes that time. Then we're going to move into our Conversation Cafe, and this is all focused on our coordinated outreach initiative, and that is the project that Ashika is helping to manage. We're going to have 2 rounds of breakouts and really do some mapping about how it is that clients come to organizations and what the issues are that they are trying to address and work through. And that will help us understand about referral processes and mapping. We're going to have a bit of comfort break in there. And then we are going to move into a session that Wendy Keeler will lead from the City of Edmonton, and that is supporting staff mental health and wellness. And we're going to have some breakout conversations for that as well. Okay, so let's move into our Network in Action segment then, and we'll invite Barb Scully to talk to us about what's happening with Healthy Aging Alberta.
Perfect. Thanks, Sheila. I think the big thing coming up is we are having regional gatherings across the province. So for the Edmonton region, it's going to take place in Spruce Grove on May 16th, and I'll make sure I put the link into the chat when I'm done talking. We're looking for people to register, but we're also looking to have people share their brilliant stories. So in the morning half of the session, we're going to go over the Healthy Aging Framework, and now we've got the cards going to print that some of you know about, where Krista has had to watch our photocopied version. So we've got the actual cards to come out and workshop with all the organizations. The second half of the day, we're looking to have a conversation cafe of people at round tables, and not so much a speaker, but to really celebrate anything you're doing around collaboration or social prescribing, anything interesting within your organization that you really want to share and spend 15 to 30 minutes talking about, and then some conversation around it. And we'll rotate through the tables 2 to 3 times, depending on how many attendees we have. So I will put the link in. I hope that some of you, because I know lots of you are doing good work. I heard rumblings. I have a few people going to apply today, but just come on, guys. It was a lot of the Sage crew, so I need some more people because we don't want the Sage show, which was their words, not mine. And I promise I've ordered a really good lunch. If that bribes anyone, I'm completely in. So those are our big things right now. We'll have lots more. We have another community developer started in Calgary. One has started in the south. We're still looking for a central and a northern person. If you know anybody you want to recommend for those positions. And we're starting to network out into the different regions. And I think that's probably the biggest update right now. Once regional gatherings are over, I will stop being the tired one.
Barb, can I just clarify? You said May 16, but it's May 20.
May 26. Sorry, thanks, Sheila. See, I was the tired one. I'll make sure I put it in right now into the chat so you all have access to it.
Okay, great. Thank you very much, Barb. That's out in Spruce Grove, right?
Yeah.
Okay, good. Rosalie, can you tell us about the Aging and Community Supports Initiative?
I could, but maybe just before I start, I noticed there's 2 new people, Sandy Sarita from Caregivers Alberta. Welcome. And Linda Ritchie as well. Does Linda want to say hello and say where she's from? No?
Hello, My name is Linda Ritchie and I'm from South Africa. I'm a caregiver and I'm just interested to find out what's happening in Edmonton with seniors and whatever. So I'm just going to listen. I've just woken up, so I can't come on screen right now. I'm sorry. But thanks
Welcome, Linda.
anyway.
Welcome.
Thank you.
Okay, so I will talk a little bit about the social prescribing, and I believe Beth might have from Sage might have mentioned the last time we gathered that there was interest from a family trust in Ontario, and a formal application did go in April, mid-April of last month. But if that were successful, then there would be some funding for 3 projects across Alberta. And that would begin in October this fall, and maybe hopefully spread to additional areas in the following year. And that project would also include formalizing a provincial community of practice for social prescribing, and include the development of shared training and resources for healthcare providers and frontline link workers, the people who are linking the community with the health providers. But what I'm also talking to you about today is that thanks to the Ministry of Seniors and Housing and Alberta Health, in their effort to reduce the pressure on the healthcare system, they have given some projects in Calgary, Red Deer, and Edmonton for 1 year. It started in March. And we're in at the Edmonton project, we're trying to give that shape and figure out exactly how that's going to work. But these projects are providing support to seniors who will be in discharge from hospital with navigation services and non-medical community supports, so they could maintain their well-being and avoid rehospitalization. And this project as well aims to build stronger relationships between community-based senior services and the health system. And we will be testing some referral processes with transition coordinators or discharge coordinators at the hospitals, and we're going to hopefully test some screening and assessment tools that would be have some learnings for the social prescribing work going on. The 3 organizations, or the 2 organizations that are trying to figure this out, is the Jewish Family Services Edmonton, SAGE, and ESCC, and obviously there's others that would be referred to in this work as well, the transportation providers, the meal providers, on and on. So we will likely inform you by email, since this group won't meet probably next month, but it'll be hit the ground running by June. And I think that's it.
Okay, thank you, Rosalie. Next, I am going to call upon Carolyn to give us an update about Age Friendly, and maybe Rosalie, I think Ashika was needing to be let back in, if you could.
I did.
Thank you.
Hello, everybody. I think Desh has joined us since we did the introduction. So Desh, if you want to say hello and welcome. And yeah, so I have a couple of updates for Age Friendly Edmonton. Just a couple of short things. Our next Age Friendly Edmonton Lunch and Learn is scheduled for next Wednesday, May the 18th, from noon to 1 p.m. We have Dr. Donna Wilson from the University of Alberta will focus her talk on healthcare ageism, and will provide strategies and practical tips on positive communication with healthcare professionals. Dr. Wilson's a professor in the Faculty of Nursing at the U of A, and a lot of her work is oriented to help ensure effective and accessible healthcare services for older people. So if you're interested in joining us, I'll put the Zoom registration link in the chat. So that is our Lunch and Learn for next week. I'm excited to also announce that, that Age Friendly Edmonton will be hosting a kickoff event in celebration of Seniors Week at City Hall. So Seniors Week is June 6th to 12th. And so on Monday, June the 6th, we will have a short program starting at 11 a.m. We will have all of our AFE volunteers and dignitaries and special guests to mark the start of a week dedicated to thanking and recognizing seniors in our community. All are welcome to attend. The more the merrier. We would appreciate if you could fan out the invitation to your network. You can contact me directly at my email at caroline@seniorscouncil.net, and I can send you the promotional poster. We're still working on final details of that, but we can get that out to you. And you can also find more information at the registration link that I will also put in the chat box.
So maybe we will move into the village news, and I'm just going to put up the PowerPoint slide again, just to help us remember what the village news is all about. And so village news is an opportunity for anyone that's here on our network gathering today to share some information or to ask for information. So you might have an immediate need that someone might be able to help with, or you might be having an event that you think we would be interested in, or you may have completed a project or an initiative that you'd like to give a bit of information about, or you have some exciting news to share. So maybe we will just open up the floor now if anyone would like to give a bit of village news. We are a big village.
I think Cindy has her hand up.
Oh, I'm sorry. Cindy, go ahead.
Oh, good. Yes, I just wanted to share a bit of news too. So this is May Hearing Awareness Month, and we were fortunate to get a New Horizon grant, actually for the first time, our association. And it is a healthcare project. We have put together kits to help seniors prepare for going to the hospital as well, so that they can be a little bit empowered about their hearing issues and not hearing medical information, because this is a really big deal for our members. We hear horror stories about it, and hospitals losing their hearing aids. And it's actually quite a scary thing for someone with hearing loss to go to the hospital, especially if they don't have an individual supporting them. So we have put together these kits and we're going around doing workshops. So if any residents or seniors facility would like a workshop on these healthcare kits, and we are distributing the kits to the seniors themselves who have hearing loss, certainly can contact me to do a presentation. So obviously it's a limited funding, so it's a year and we've already started. So if you do want that, don't wait, because I am booking already into the fall. It did take off quite well, so but we're pretty excited about that. We also have a golf tournament coming up if any of you are golfers, June 15th, and all the money raised is to purchase hearing aids, again, for those who can't afford them, and predominantly that is in our senior population again. So if you can support us. We also, lastly, I'm not going to take much more time, but lastly, we also have some WestJet tickets.
Oh,
We were fortunate to get flight for 2 anywhere they travel. And again, that's going to purchasing hearing aids for those who can't afford them. So you can always contact me and I'll put my email in the chat box for any of those items. So that's my news.
thank you very much, Cindy. Anyone else like to share some information?
I guess I could share some updates with the Family Caregiver Wellness Initiative project. We've just started to roll out the rural arm of the project, and that has been a difficult endeavor because reaching those rural communities is a bit harder. But we've made some successes, and we have developed a system where we could actually like get some of these workshops out. And I think it's just such a big accomplishment to talk about, given the day-to-day struggles that we faced to like reach these the rural Albertans. We're still trying hard to reach the Indigenous community, which is a little bit more tricky, a bit more tricky than rural Alberta, you know? So these small steps, I think, could pave the way for other organizations to like to be more impactful in those areas that are less surfaced, you know? So that's about it.
Thank you, Danny. I saw Josie from SPESA.
Yes, hi. I'm just kind of excited to share that 2022 is SWESA's 10th anniversary since incorporation. And we also got some funding through a special project, and we're planning a year of 10 activities. It'll be starting with the 10th birthday party on June the 9th, and it'll culminate with a seniors wellness fair on October 1st. And the main activities will be to encourage and reach out to seniors in the communities around where we're located in Blue Quill to join SWESA or other communities in the neighborhood to support them. So we're really excited about that.
Yeah, 10 years. Boy, that's flown by, because I remember when you first started.
Yeah.
Long ago.
Well, and I'm trying to forget the last two, so maybe it'll only be 8.
Well, congratulations to SWESA on your anniversary, for sure.
Thank you.
Anyone else have any village news?
Sophie has her hand up.
Okay, Sophie.
I'm gonna lower hand. Hi, everybody.
Hi.
I hope today finds everybody well. I do have some announcements or some events that I'd like to share. So Ventero, June 21st, we're going to be having a Indigenous Peoples Day celebration over at our Parkdale location, and the address is 11648 85th Street. And that's for communities, so you don't have to register, just show up. They usually start with a pipe ceremony about 8:30 or 9 o'clock in the gym if anybody wants to partake in that. And also we are having our cultural camp coming up. It starts on the 17th, 18th, and 19th. I'm just gonna share screen if that's okay. Choose what to share. Okay. Just give me a second. That's not it.
June 21 is solstice.
Yeah. I'm not sure how to share.
Do you see the green button on the bottom? Does it appear?
Green button that says share screen.
Yeah, and you hit that, and then you have to choose what screen you'd like to share.
So shoot, it's not allowing me to share what's on, because I was just going to go over to the Ventero website, and for the culture camp, let me just go there, because you guys can hear me anyway.
Yes, and you could post the website link in the chat link.
Oh, okay. Okay, I'll do that. So So we're going to be having our culture camp, and it's a 4-day event. When you go to the website, you'll see registration is required, and there's different activities for like the first day would be Bentero staff and children's service partners. June 18th would be families and community. And day 3, June 20th would be community agency partners, and June 21st would be closing ceremony with all participants. So that's all community and community agency and staff. As a community agency partners, that would be ideal to register in that area. And there's a registration button that you can register at, or day 2 or day 4 would be ideal. But the first day, June 17th, that day is for Bentero staff and children's service partners. But you're welcome to register for any of the day 2, day 3, or day 4. And that's on the Bentero website. I'll copy and paste the link in the chat box for everybody.
I think Wendy has shared the screen with the website and posted the link.
Oh yes. Okay, so awesome. Thank you.
Covered. Yeah, it looks like a really, really good event.
Yeah, so it's gonna be really amazing. We're gonna have a lot of cultural teachings for each day. Yeah, it's gonna be really awesome, and I hope to see a few of your faces there.
Thank you so much for sharing.
You're welcome. And that's all I have for Village News.
Okay. Christy from Elder Care. Krista, sorry.
Yeah, so we have a few things happening at Elder Care. One of the first things is to celebrate Seniors Week. We at Elder Care are we were looking for a way to bring in some intergenerational programming and awareness around Seniors Week. And so we are going to be launching an Elder Care Edmonton coloring contest for kids as a way to get involved, for seniors who maybe have grandchildren who would enjoy something like that. And then what those coloring contests will do is we will bring those back to our day program clients who will be our judges for the official contest for the kids. So a way to bring in some intergenerational programming, but yet for our clients still with a bit of a distance, with COVID-19 still being a risk for our programs at this point in time. We also are going to be having a booth at the upcoming Caregivers Alberta conference that is taking place tomorrow and Friday. So that's where we will be tomorrow and Friday. And then one of the other projects that we've been working on here at Elder Care, we've called it Project Tovertoffel. And Elder Care Edmonton is the first in Western Canada to have received a device called a Tovertoffel. And what the Tovertoffel is it's an overhead infrared projector that interacts with touch. So you can interact on a table surface or on a floor to do group projects and play games on a tabletop surface or a floor surface. So things like soccer or cards without actually having a communal object such as a deck of cards or a soccer ball in which would need to be physically touched. So it's an very IPC friendly device developed for dementia clients by healthcare staff. And the games are all developed as well with healthcare staff and long-term care residents. And so we're the first in Western Canada to be launching a Tovertoffel for day program services. So we're very excited to have that up and running fairly soon in our day program.
Wow.
For me.
Sounds great. Maybe in the future you can give us a little demo of that.
Yeah. look for some projects as we start to launch it into our day programs.
Okay, great. And I see Jacqueline Chingrell has joined us. Jacqueline, do you want to introduce yourself and say which organization you're from, if you are from an organization?
Thank you, Sheila. I appreciate it. Hello, I'm Jacqueline Gingell-Sarich. I actually work for Alberta Blue Cross. So I'm in their Business Development and Strategic Initiatives Department. And I've only been in the role actually since October, but I have with Blue Cross. I've been with Blue Cross for over 8 years. So I have an analytics background, and now I'm kind of trying to use that to work in this space and learn more and how we can kind of support the community. So very happy to be here. Thank you.
Great. Welcome, Jacqueline. Have I missed anybody? Any more hands up for Village News? Hearing nothing. Okay, I think we are ready then to move into our next part of our agenda, which is our conversation cafe. And so I'm going to turn it over to Ashika. And maybe she can walk us through what's going to happen now for our breakouts.
Hi everyone, hope you guys are enjoying the session today. So today we're going to do a little bit of an activity. We thought it would be really helpful as we're building this coordinated outreach strategy to start to get a sense of how different folks interact with your organizations as they enter them. So where do they go? What happens to a client? Where do they get stuck? And where are the referral links between your various organizations? So the activity we kind of had set up today, I'll just pull up the mural, is that we were hoping that a person in each group could share a story about what it would be like for a client to enter your organization and what would happen in that situation. And the folks in your group can help you in kind of mapping out what that would look like. So these are all different boards to work on. I have two because we were intending to do 2 sessions. We may or may not do that, but if you look on a board, you can just zoom in, and the way you zoom in is bring your 2 fingers closer to you. So you slide them like this towards you. And then you can see here that there's some sticky notes and then a little check marks and a little X thing. And basically what we thought you could do is say you have a group and this is where the client enters, and then you can draw little arrows on the side here to show, okay, so the client goes here, or they might go over there. And then you can put more stickies and stuff to kind of build a little map as the storyteller is sharing their story about you know, what it would be like to be a client in that organization and where they might go. And if you hear something as listeners where you're like, oh, that's kind of interesting, I've never heard that before, or that must work really well, or I think that would be really helpful for clients, then you can put a little opportunity check mark, and you can even add a little sticky saying, okay, this is why I think this is a great opportunity here. Or if you see a place where people might get stuck or really confused or lost, you can add a little threat box right here. You can drag it to wherever you want to go. And then, yeah, you can write again what you think the threat would be or what might cause a barrier for someone trying to access service. And so I thought it would be like maybe a really nice collaborative opportunity to get to learn a little bit more about how some of you like approach your work and see if there's lessons that we can learn together. So yeah, we have some wonderful volunteers who have offered. I am a little bit short on volunteers. Some of the folks who said that they would be able to make it unfortunately haven't. So if anybody's interested in telling a story, we would really highly encourage that as well. It doesn't even have to be a story from your organization necessarily. It could also be a story from a senior in your life trying to access a service in an institution and what that was like for them. So yeah, that's the breakdown of the general activity. Does anyone have questions about the activity?
And Ashika, I just maybe will add that the coordinating council staff will be helping with doing the mural parts, so people don't have to feel like they need to navigate mural. If you're worried about that, we can make sure that happens in each of the breakout rooms. So we've had a facilitator assigned to each room.
Yeah, it's very intuitive. So if you want to play around with it, feel free to have at it. We will give you the link so you can take a look. But if you feel like, oh my God, this is too much, you can direct your facilitator in the room to write down whatever you're thinking and feeling. Yeah.
Okay, great. Any questions about that from anybody?
Sheila, I wonder maybe just a little bit more about the coordinated outreach project. There might be some people in the room that are new to the coordinated outreach.
Okay, sure. That's a good idea, Rosalie. For those of you who may not be aware, the FCSS Family and Community Support Services have requested that the Coordinating Council guide a review of outreach services to seniors, and with that, looking also at how it interfaces with the Home Supports program. And so we have been doing this initiative for about a month now. Our purpose in doing this is that we are working together with organizations, both who are currently funded to do outreach and those who are not, but would like to make sure that clients that they have are able to access outreach services. So we've been bringing people together. We've had 2 meetings now where we're working to create a coordinated approach or a model for providing high quality outreach related services for older adults. And the model would include shared collection and analysis of data, accessible referral system, shared evaluation, addressing equity and inclusion for clients, building on the work to date and on existing assets, and some sort of collaborative agreement defining roles and responsibilities, which we hope would be developed by the end of this year. So that is what Ashika is helping as project manager for this initiative. And we'll be coming up with task groups that will kind of dig into more of the actual chunks of work, which include mapping referral pathways and looking at how the current outreach model works, and just lots of other pieces. So that's a bit more about the project. And so this exercise today is really to piggyback on this opportunity with the network to get you guys to help us look at the way that people come to you, what they're looking for, what issues they might run into. And that can be very helpful as we're doing this work around coordinating outreach and home support programs. Any, Josie? Yeah.
Well, can I just ask, when you're talking about outreach, so who is referred to as outreach? Like, I know that some centers the senior centers have social workers, but who else is it with AHS and other organizations?
That's a good question, Josie. So currently there are 12 agencies in Edmonton that are funded by FCSS to provide outreach. And so there's about 20 workers. And what they do is they would outreach, maybe I should define outreach. So it's referred to as a type of service where people are connected with supports. And so the outreach workers, they would look at case findings, so trying to make sure that people that need help are getting help. They would do some sort of assessment with a senior. They would provide information and referral. Sometimes case management is required. So if the person has some complex issues that maybe need a lot more time to address, a case management process would be started. There is some system advocacy that is done through outreach. And there's also opportunity for creating awareness and mobilizing support through outreach. So the coordinating council, we've been facilitating meetings, convening the outreach workers at least every other month for many, many years. And we have done reviews of outreach services and created manuals for the workers, much like we've done with home support coordinators, but there is no common database like home support coordinators have. So the organizations, the 12 that are currently funded to do outreach are North Edmonton Seniors, West End Seniors Activity Center, Strathcona Place, Millwood Seniors Association, SAGE, and they work with the multicultural health brokers, Edmonton Senior Center, SCONA, CISA, Operation Friendship, Antero, Métis Child and Family Services, and the Shama Center. So those are the 12 that currently are funded for outreach services.
Thanks.
Does that kind of answer your question, Josie?
Perfect. Yeah, thank you.
Okay, great. So now I think, Carolyn, if you've been able to set up the breakout rooms, I think we might be ready to go into the breakout rooms and to hear a client story. We were having a great discussion. I hope you guys did too. But now, does anybody want to make any comments about the breakouts or the exercises? How you found that?
I'd just like to make one comment because it was a big aha for me, and that was language. So, you know, all the other discussion I anticipated, but language, that the way we refer to things, particularly in the interactions with the health system, so hospitals and primary care networks, that things like refer to, and this is thanks to Mary, refer to the transitions in care, discharge planning. Because if you say those words, it will take you exactly to the people that you need to be talking to. And sometimes that we speak in our language from the sector and not the language for the sector we're trying to communicate to.
Yeah, that's a great point, Jan. And when you first mentioned language, I thought you were actually going to talk about different languages and the barriers that presents. I'm not sure if anybody in their stories had something like that, but yeah, you're right. Like we assume, you know, words mean certain things and that people will know what we mean, but sometimes there's specific language that has to be used to help you make connections. So thank you for raising that. So I think we are now at the point where we want to move into our next item on the agenda, which is with Wendy from the City of Edmonton. And Wendy is going to be supporting us in discussing staff morale and well-being. And this has become quite a huge issue. I'm sure lots of the organizations on the call today can attest to that. So maybe Wendy, can I turn it over to you now?
Absolutely. So one of the things I just want to say from the get-go is I'm not here to speak about I'm not here to give tips about how to improve morale. What instead we're going to do is, or a presentation, but what we're instead going to do is just have a conversation in some small groups where we can kind of talk a little bit about how your staff are doing, the organizations that you're working with. If you're here as a board member or as ICLG, think about your team that you're working with as ICLG. So you can think about it in a couple of different ways, whatever works for you. And then just, yeah, what are some of the things, and I'll actually share my screen here just for a second. I'll show you kind of where we're going to capture this. So, and I can't really see you, so I'm gonna just 1 second. I just want to make sure I can see your faces while I'm talking. So I've just put an image on the screen, and we've got 3 questions for this segment of the of the session today. So we just kind of want to get a sense of how staff morale has been in your organization. So I've created a Jamboard here. I'll show you how to do it in just a moment. And there's 3 questions. So the first one is, how has staff morale been in your organization? There's a few different slides there, so you can just choose whichever one is empty for your group. The second question is, what have you done or could you do to improve staff morale and wellness in your organization? And the third one is, how are you keeping up your own morale and wellness as a leader? So some folks are entering here as executive directors, some folks are not, and that's okay. But how are you keeping up your own staff or your own morale and wellness? So those are the 3 questions I'd like to invite you to have a conversation about in your small groups. So I'm just going to invite you guys to share back a little bit. So we just have a few minutes, 10 minutes or so, or 12 minutes or so to share back. So maybe I'll invite Cheryl's group to share back first. Do you want to? You can share your screen and show some of the. You don't have to share everything, just some of the highlights, maybe. A couple of things that popped out. We can't hear you, Cheryl, either.
Wendy, could you be the screen sharer so that
Sure.
so that you can just slide back and forth?
As long as you tell me which one you're on.
Yeah,
so.
yeah. Ours are the lime green sticky notes.
Absolutely. All right.
So chime in, anyone from the group, please.
So maybe, yeah, if there's anything from the first one, it's probably not going to have as many things as the latter 2 questions. So yeah, I'll mute myself so you guys can take a few minutes to share some of your gems.
So I'll speak to just the first one. We had a small group and 2 folks from the same organization, but one who'd been there a long time and one who was very new. So we got a first impression, of sort of the positive working environment that the new person was coming into, and then a longer term impression of, the pandemic kicking all our butts. So we did also make a note that, in some small organizations, maybe the feeling was different than larger ones. Flexibility maybe was easier during pandemic in terms of the way that people were able to work and such. So that's just a summary. Do you want us to do all 3, Wendy, or is other people doing number 1? Oh, all 3. Okay. Pop over to the next green one. There you go. There's all the ways that people have done or could do to improve. Again, the flexible working style and conditions, really encouraging people to take holidays, sick days, stress leave, whatever they need. They had introduced a peer support program amongst staff members, but also others that might be in your tight circle that were supportive. Have, when you're on stress leave, the support of a manager, how better that feels than just kind of being there on your own. And a really nice point about in some organizations, there was a stretch to have family supports, take a look at the whole family, not just the employee, for example, from a nursing background. Their whole family might need counseling and support. So that was appreciated. And then we didn't really spend much time on the leader piece, other than kind of leading by example, leaders being vulnerable and human. Stress is the same for everyone. And then Ruslan, do you want to share that example? I don't know if I caught it. Leaders checking in with a whole group, even if they weren't a current employee, that might have been somebody else in your sort of close team circle, and not to forget them, even though their role may have changed or their relationship might have changed.
Yeah, I was just sharing my example, my experience with an AHS director who was just when COVID hit March 30th, 2020, with my contract ended, and I only worked with the team for like maybe 4 months or so. But the director at the time invited all team members, including myself, who had just left, for informal coffee chats on Zoom until like July 2020, just to make sure we're included and part of a team and checking on us, because the person knew that we were out of a job and potentially with no connections and with everything shutting down, just wanted to reach out to former employees. So I felt like that's an excellent example of leaders reaching out to their employees and beyond, and setting example of how to be how to show empathy and also being resourceful. So that kind of stood out to me as a great leadership, promoting wellness not only for the staff but beyond, and setting great example for the team.
Great. Well, thank you, everybody in that group. You've got a lot of great ideas there. I'll pass it to Sheila now.
Oh, or Barb, or anybody in our group. You'll have to scroll back. We didn't use different colors, so I'm not.
Number 2 is our first one.
Okay. You could go ahead, Barb.
So we just talked about how it's high expectations. People that kind of work in the nonprofit sector also have big hearts. So you can not always have that balance on personal and professional life, because you kind of worry about everything. So we do have the bit of fatigue around that. We have organizational fatigue because we were so long on virtual. High expectation from everyone around us to navigate stuff like, oh, you work in the nonprofit sector. Do you know how to do this? Do you know how to find that? There's those things. And then just everything feeling urgent all the time, because most of us are funded. So we have deadlines and really high expectations to hit them. And the virtual meeting piece, it's nice to start having stuff in person, because everyone after 2 years was just tired of virtual. And I'm not sure which number is our next one. No, that's not it. This is it. What could we have done? I actually want to bring in one that we put on the last one that Sheila brought up last, but it should have been here, as she pointed out. Instead of having sick days, she talked about having wellness days at the organization to really celebrate that and making sure people take time for themselves. Things to improve is finding ways to make personal connections with your team, especially if you're virtual. Make sure you are having regular in-person staff meetings. Setting times to disconnect from technology, because we're really stuck at home so much, and being on tech even when we are at home now. Sheila's organization brought in ergonomics for work from home people, so they could really look and make sure that people in their workspaces, even though it wasn't in the office, it was really good. Creating structure around breaks when it comes to virtual meetings, so you're not just going back to back, jumping from screen to screen all day. Making space for those people that maybe aren't quite ready to be in the big setting with crowds, especially if they're working with a vulnerable population, and just really making space for those that aren't ready to leap back into this part of the pandemic world. And then assisting in finding solutions for people that struggle with the online pieces. So many people, even 2 years in, just struggle with the online piece, the virtual meetings, or being on hold, like the frontline workers, the outreach workers being on hold for so long because everything is backed up. And then as well, Sheila's organization brought people in on as coaches, et cetera, for mental wellness and different resources for staff. And last one, nope. Which number were we, guys? Go back a different one.
That's ours.
That's ours, the blue. I forgot we did so much in blue, thanks. Are we keeping morale as wellness as leaders? Is holding space for ourselves as much as we do for other people. Kayaks. Somebody may have got a beautiful kayak and takes a tech-free nature break and will feel guilty if she sees it hanging on the wall after investing in it. So it's a little bit of a forced morale. Some self-reflection. Important to acknowledge when you're not at your best and let others know, and that it's okay to close a meeting, cancel a meeting, or postpone something, or just let other people know you're not on the game completely that day. You can have boundaries, and then also strengthen your relationship with your friends and family. So make sure you're taking those times. And
Well,
those are
thank you. Thank you, group. We don't have enough time for everybody to share back, unfortunately. So I'm wondering if there are any real last thoughts around like one gem that you might like to pull from your conversation if you haven't been able to share so far. Sorry for the lack of time there, folks. If anybody wants to just add anything, you can raise your hand and start speaking. And then Sheila's going to wrap up for the day.
Yes, thanks very much, Wendy. And we'll capture what some of these great tips have been and put them in our notes and share back